This includes a number of items in the budget that directly impact the residents of Central Region. So I'm now going to call upon Premier Furey to speak about these investments. Premier?
Thanks, Minister. This podium is at an MBA height, though, I think. I'm not sure it's meant for either the Minister or myself. Good morning, everyone. It's certainly a pleasure and an honor to be here in the beautiful district of Gander. I got to tell you, I haven't been in this hospital since I did a medical school rotation here in probably 1999. I enjoyed my time then, and it's good to see that the hospital is still vibrant and productive as ever before. It's a pleasure, though, to be here. It's a pleasure to be here with my colleague, Brian Moore, Chris Tibbs, mayors. It's always great to see you. And I have to tell you, anytime I come to Central Newfoundland to see the collection of municipal support that comes out to support the communities, to support announcements like this, really means a lot. And it's not just symbolic of the announcements we're making or of our government. It's symbolic of the basic building blocks of our and the foundation of our province, and to see good people stepping up in leadership roles is incredibly important to the sustainability to which the Minister and I always speak. So thank you as always. But a special thank you to Minister Haggie. I'm really happy to join you in your district. Of course, Dr. Butler, thanks for everything that you do and for being here. But I think we all, need to reflect on the task that Minister Haggie has been assigned over the last couple of years. He's taken a lot of heat, but he has always been defined not by the challenges that he faced, and they have been many, a cyber attack, a pandemic, just to name a few, and imagine that, those are just of a few of the challenges that he's faced. But sir, we're never defined by our challenges. We're defined by how we respond. And the response that you have led on behalf of the people of the province during troubling times of a pandemic and a cyber attack, I can tell you personally as Premier, the advice that you provide to me and the people of the province is greatly appreciated, and I think deserves reminding for everyone in our province. So thank you very much, sir. And thank you virtually to Ms. Robichaud as well. I understand that you continue to work carefully and continuously with all the fine people of Central Newfoundland to ensure that they are getting the quality health care that they deserve in the region in which they're born and raised. We recognize as a government the changing demographics in our province, and in turn, the challenging health care issues that creates. We also recognize that we as a government need to deliver services differently as a result. We simply cannot keep doing the same thing over and over again, following the old models and expecting different results. Simply put, we can't continue to have a model that's based on a 1960s population scheme, when our province had 6 children for every senior. Today, as you all know, we have almost 2 seniors for every child. For just over 500,000 of us, we spend $3.6 billion year after year after year on health care. By far the most per capita out of any province in our country. Yet we continue to have the worst outcomes, the highest burden of disease, the lowest life expectancy. As I've said many times, you could argue that if we spent that money and everyone was living to be 100 and was happy and healthy and playing tennis and hockey and all of these kinds of things, then that would be a good expenditure of money. But that's not true. And we need to accept that that's not true. And we need to look at how to deliver things differently. Like every other jurisdiction around the world right now, we see it, not just in Canada, not just in other provinces, we see it in the United States, we see it in Europe. Recruitment and retention of healthcare professionals continues to be a significant challenge. I know firsthand, Dr. Butler, that healthcare professionals are tired. They just put in a heck of a 2 years. I've had the honor of working alongside many of you for many years. I see it, I hear it, and I feel it. And thank you from the bottom of our hearts, on behalf of all of Newfoundlanders and Labradorians, for sticking with it. Family doctors in particular, and especially in rural Newfoundland and Labrador, are the building blocks. They are essential for our healthcare system. The work you do as family doctors, Dr. Butler and others, not only help shape patients' lives, you help create and sustain a new system moving forward. And we know you're tired. We hear you. We value you and want to work with you to protect you and ultimately the patients of Newfoundland and Labrador. My commitment to improving the system, all elements of the system, for all of us, has been steadfast. I can tell you it would be politically easy, financially easy, logistically easy to regress to where we were before the pandemic, to where we've always been. But as I've already said, I believe that that would be the wrong approach. And I didn't enter politics to make wrong but easy decisions, as easy as those decisions may seem. We need to be bold, we need to be courageous, and we need to recognize the challenges and embrace them for the change that is required for the future of our province. Now, woven throughout Budget 2022 is a narrative of how we are responding to these and many other issues. How we as a people are navigating towards a brighter future by helping to address the healthcare needs of the people in every region of our beautiful province. None of us can tackle these challenges on our own. That is why our government is taking a collaborative approach to finding sustainable solutions that benefit all of us. Now, Health Accord NL is offering recommendations to reimagine the system, and we need to. This system hasn't been reimagined since Medicare was introduced in the 1960s. We need to lead and can lead the country with our evidence-based systems approach. Any politician, anyone who's elected or non-elected, trying to get elected, can promise money. Anyone can do it. It's easy. It's often politically rewarding and easy to do. But what we are trying to achieve, what we are promising to do by working together, is to promise changes in outcomes, because that's what really matters. Outcomes for our nurses, outcomes for our GPs, outcomes for our patients. It's certainly not about cuts. It's about improving outcomes and focusing on the social and economic determinants of health, factors that have often been ignored but are critical in influencing the health outcomes of people's lives. Now, in just 1 year, our government, under my leadership, I believe we have made good strides. And other jurisdictions, I can tell you from the Premier's calls around the country, are looking to us and our Health Accord as a template for possible change in their jurisdictions. These initiatives will act as an early foundation upon which some of the recommendations will be built. The initiatives announced last fall, combined with ones on paramedicine, supporting our existing bursary programs, and funding for the family, continued funding for the Family Physician Renewal Program, add up to an annual investment of approximately $30 million. Budget 2022 allocates more than $14 million in new money to continue to implement those measures to help improve access to primary health care in Newfoundland and Labrador, including some of the following initiatives. 2 new collaborative care clinics in the metro region, establishment of at least 1 new collaborative team clinic in each of the Central Health, Western Health, and Labrador-Grenfell Health regions to supplement the team-based approaches already existing in some of those jurisdictions. A request for proposal for development of a health human resource plan, which the NLMA and the Nurses Union alike have been arguing for years. Establishment of a provincial health professional recruitment and retention office with a new ADM. 2 pilot projects to attract more medical graduates to family practice. Facilitation of immigration pathways to help international health professional graduates come and work here. These are important components to improve access to primary health care for the people of Newfoundland and Labrador, including here in central Newfoundland, as well as competitive incentives for family physicians to continue to practice here. We've expanded services of 811 to mean that across the province right now, nurse practitioners can be accessed for urgent and non-emergency care issues for 12 hours a day, 7 days a week, largely led by the Minister's directive. Since the onset of the pandemic, coupled with challenges of accessing primary health care, particularly in the central region, health hubs have helped fill that service gap. Serving between 50 to 70 patients per site each day, the hubs here in Gander and Grand Falls, Windsor continue to be important points of contact for patients in this region. We are pleased to announce continued support for the continuation of these health hubs in the areas previously described for Budget 2022. Now, the Minister and I know that that's not the final answer and that's not the permanent solution, but it is a tool to help us get to a more integrated, cohesive system. This support, of course, aligns with our funding for a new collaborative team clinic for the Central Newfoundland region and the upcoming launch of the Patient Connect NL, where unattached patients can register for this clinic. Virtual ER services also provide continuity for the delivery of essential healthcare services, particularly in supporting physician shortages and recruitment challenges in some of our rural settings. My friends, the pandemic has taught us how quickly we can pivot and how well it can work. It taught us that, I believe, challenges are only opportunities in disguise. The Budget 2022 continues on that path with 2 virtual ER services in Central Health Region to help with urgent care. And here at the James Payton Memorial Regional Hospital, along with Central Newfoundland Regional Healthcare Centre, a second paramedicine team has also been implemented for 7 days a week with a second crew on standby. Our government's goal is to improve health outcomes and focus on the social and economic factors that influence people's health. Things like affordable housing and childcare, actions that we have already taken. On a high level, Budget 2022 includes funding to advance a 5-year plan for alcohol prevention, along with a range of treatment initiatives. It also includes support for Life Promotion Suicide Prevention Plan to help Newfoundlanders and Labradorians with this terribly complex public health issue. One life lost to suicide is one too many, and our government has allocated $2.5 million to implement that plan, with a commitment of approximately $5.5 million annually for the next 4 years. You will hear more about these initiatives in the coming weeks, of course. We know the challenges we face in our healthcare system. We know also, though, that it didn't arise overnight. We know this has all been aggravated by the pandemic. And we know, if we're all being honest, that there is no easy fix. There's no magic bullet. There's no one line that the Minister or I can stand up in the House of Assembly and blink our eyes and it's all going to be fine. But we do know that we need to focus on these solutions together in a collaborative fashion for the best interests of the people of the province, because we are facing them together. The Minister and I have families as well. We use the healthcare system. We all do. We all want what's best for the healthcare system. And I believe we are making progress through a collaborative approach together. I used to say to medical students in my old life, when we were about to go into the operating room with a bone and a million pieces, I said, "What are you going to do now?" I said, "You have 2 options." The more complicated the case, of course, the better this analogy was. You can run away, or you can take ownership and start to build this bone back stronger. We need to all rise to that challenge and build the system back to be stronger, to be more reliable, to be more efficient, effective, and ultimately a proud place to work for our healthcare professionals. So all hope is not lost. We are making good progress. There's still much to come. As I've said many times, we can't keep doing the same thing we have always done. It's Einstein's definition of insanity, right? Keep doing the same thing over and over and expecting different results. We need to be bold and courageous and recognize that we can't do that we need to shift the paradigm to a new style of medicine, that we need to own the evidence that we've created to develop a system here that works for a sustainable Newfoundland and Labrador. The old paradigm isn't working. It may be romantic. We may all want to continue to hold on to it, but we need to recognize that the faster we can change, the better it will be for Newfoundlanders and Labradorians. That is what sustainable healthcare is in 2020, and we need to make sure that we are owning that opportunity to lead the country to develop the system that works for the people of Newfoundland and Labrador. Change is in the air. I'm proud of what we have accomplished, and we're only getting started. So thanks very much for the opportunity, and I'll turn it back to you, Minister.
Thank you, Premier. As the Premier noted, Budget 2022 includes continued expansion of collaborative team clinics. These are going to improve access for Newfoundlanders and Labradorians, but also will provide work-life balance for physicians and other healthcare professionals working in these teams. The team means there's support, from administrative support to diagnostic to therapeutic. They serve as a one-stop shop of health services for patients and residents. The virtual ERs at 2 of Central Health's referral sites will be staffed 24 hours a day. The expansion of the role of virtual care is another part of our ongoing work to provide support and options for care across the region. Continued investments in paramedicine resources help improve call response times. That's the metric to watch. Increases paramedic presence in the ER during the busiest times of the day and improves the health and safety of the people of central Newfoundland. To add to the important initiatives the Premier mentioned, Budget 2022 also includes $10.3 million in funding to add new drug therapies to the Newfoundland and Labrador prescription drug program, which contributes to better health outcomes. So at this time, I'm going to turn things over to Andrée Robichaud, and she's going to speak about the importance of these initiatives for Central Health. But before I do, I'd just like to thank her for always being available when called, always having a solution in her back pocket, even when the problems and the challenges seem to just multiply. And as the Premier said, it's not about the challenges, it's about how you face them. And so with that, Andrée, Ms. Robichaud, I'll turn things over to yourself.
Thank you, Minister. Can you all hear me?
Yes.
Great. So, good morning, Premier Furey, Minister Haggie, members of the Central Health Board of Directors, MHA Brian Moore, MHA Chris Tibbs, Mayor Farwell, and Mayor Robichaud. On behalf of the senior management team and our employees at Central Health, it's a pleasure to have you here today, and especially when you come to provide us with these great investments. I want to start by thanking the Premier and the Minister for the investments in the collaborative practice, health hubs, virtual ER, and our funding for our ambulances. These initiatives were developed to address community needs, and we worked with your officials to develop a business plan that government could support, and you did not disappoint. These investments are very well aligned with the Health Accord recommendations. I believe the future of primary care will become a combination of virtual and in-person visits, and Newfoundland and Labrador is well positioned to lead the way. We do recognize our current challenges in healthcare are impacting everyone, and we're working on contingency strategies to address these issues. We know residents have questions, and coming up in the next few weeks, we're hosting a series of virtual town halls where we will be hearing from our physician leaders about virtual ER and primary care and what we are doing to tackle nursing and physician recruitment. So please keep an eye on Central Health website, our Facebook and Twitter, as well as our radio stations to find how to register. Before I go, I really would like to thank the staff and physician who give their all each and every day to provide the best care possible for the people in central Newfoundland, and whose work is supported by many of the initiatives that we are talking about here today, namely our virtual ER and our health hubs and our ambulance services. I also want to thank your officials that have been very supportive in developing these initiatives. Premier Minister, I am blessed with a wonderful team here at Central Health, and every day it's a pleasure to come to work. Premier Minister, with an announcement like these, we hope you'll be back real soon, and thank you for all you do for Newfoundlanders.
Thank you, Andrée. I want to take again the opportunity to thank the staff of Central Health. We're here, and it's only fitting that I recognise the amount of hard work, effort, and endurance that the staff have shown as COVID has come and gone and come back again. At this point, I'd like to introduce Dr. Jared Butler. Dr. Butler and I go back a long way, and despite having a busy family practice, he still finds time to lead the province in concussion initiatives around hockey, filling in his spare time now as acting director of medical services, not to mention being heavily involved in the family health network in Central, which has been foundational in improving primary care services across all sides of the region. Our physicians, particularly our family physicians, have continued to step up, and despite all the negativity that's out there, they go to work, they provide the service, and the people of this region are all the better for it. So, Jared, Dr. Butler, the podium is yours, sir.
Premier, Minister, thank you for that welcome, sir. Appreciate that. Mr. Chair, Madame la Présidente, members, honored guests, thank you for being here today. Speak a few words this morning on the funding announcement, and want to note that it offers continued support for the work that we have been doing here at Central Health for the last couple of years. In an effort to offer primary care support to patients in need within our region, the team at Central Health initiated 2 programs: the Health Hubs, based in Grand Falls, Windsor, and Gander, and their partners, the virtual emergency rooms. Building upon work within Canada and around the world, these innovative programs allow patients within Central Health to have access to primary care providers and meet their immediate needs. While not replacing the value of an established, continued relationship with a primary care provider, the Health Hubs have helped thousands of patients and will continue to evolve as tools within our toolkit as we shift towards a model in line with the patient's medical home. Another innovative tool that we have developed are the virtual emergency rooms here in Central Health. This service, while still evolving, has allowed us to support emergency care needs in our rural and remote sites around Central Newfoundland. The team at Central Health has worked hard to be innovative by developing and implementing new models of care as we shift to modern healthcare delivery. We have worked hard to be ahead of the curve and Health Accord NL at Central Health in our attempts to meet the needs of our patients while continuing to work on recruitment and retention of our nurses, allied health professionals, and physicians for our team. I'd like to take this opportunity to thank the Ministry for their support of this program and the Premier for the announcement today. I especially want to thank everyone at Central Health who has worked so hard through the pandemic to support their communities and continue to give of themselves for our friends, our families, and neighbors. Your efforts are greatly appreciated and do not go unacknowledged by us. Thank you all, and thank you for the announcement today.
Thank you, Dr. Butler, once again. I'm delighted to be here today highlighting our continued investment in healthcare in this province. As the Premier indicated, our healthcare system is facing many issues. Some have been prevalent literally for decades and require significant change. Some are related to the province's ageing population, and the Premier referenced that earlier on. Some are related to our lifestyles. Some have arisen from the pandemic, and the pandemic has added to each and every one of those other facets. Guided by some of the recommendations of Health Accord NL, Budget 2022 continues down a course of action to, as the Premier has said, reimagine the system. The aim is to best deliver health services. We won't solve these issues overnight, but we're focused on recruitment and retention of healthcare professionals. Earlier this month, the Premier and I joined nurses from across the province for a virtual nursing think tank to listen to and address issues facing their profession. We committed to meet with them within 2 weeks to discuss the results of that think tank. The first meeting was yesterday, and I'm delighted with the level of energy and cooperation between the department and Ms. Coffey and the RNU. And it fills me with optimism that we again have solutions to the challenges that we're facing. We have to take into account many factors when we look at the changing demographics and the need to focus our efforts on collaborative team clinics. This is where people will have a health home to serve their needs, as well as access to virtual care. We're looking forward to a continued working relationship with all elements of the healthcare sector, and we maintain a focus on addressing the issues as they come. So this concludes my comments for today. Thank you all for coming. We'll discontinue now our live stream, and to those in virtual land, thank you for your attendance.